Bismillahirrahmanirrahim. This is in continuation of what we discussed earlier about vaccine preventable disease, and we discussed about diphtheria. I want you to have a close look at this infant and listen to him carefully.
It's just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath in, honey. Come on.
So, what do you see? He continues to cough a lot, and then he has got this
There
big
we go.
inspiratory whoop,
Oh my.
and as he continues to cough,
It's
he is distressed, he is in
okay.
pain and agony, and his lips
It's
and
okay.
tongue, you can clearly see they turn blue. And he takes a deep breath, a little relief in the cough. So he is suffering from what we commonly call whooping cough or pertussis, caused by Bordetella pertussis. The syndrome actually may also be caused by other bacteria and certain viruses, including adenovirus. But the pertussis caused by Bordetella pertussis itself is a highly contagious disease. The infectivity period is during the first 4 weeks of the illness, the period we call pre-paroxysmal period. Droplet infection is a mode of infection. After the natural disease, active immunity develops, but neither this active immunity is secondary to the disease or the immunity after the vaccination gives lifelong coverage, hence chances of reinfections, unless supported by the booster doses of vaccines. An important thing to remember is that once vaccinated, reinfections may occur, but they generally are mild and have got very few complications. The pertussis in itself has got 3 stages. The first stage, where there is a lot of runny nose, coryzal symptoms, lasts for up to 15 days, followed by a paroxysmal phase where the infant coughs like the infant we showed you earlier in the video. There are paroxysms or attacks of cough where they might have difficulty breathing, they may turn little blue, sometimes they may vomit, and young infants may go into apnea. This may last for up to a month, and then another couple of weeks of recovery phase. Now, the presentation is little different in young infants compared to the older children and adults. Of course, cough would be the hallmark, but there would be episodes of choking, apnea, and cyanosis in young infants, which may not be seen in older children and adults, where they would have prolonged mild cough, but there won't be any whoops as you saw in the video. History of vaccination in these infants and children is very, very important, as is the history of close contact with anybody suffering from cough or similar symptoms. The disease is sometimes complicated, and the complications can be as devastating as pneumonia. And remember, when we talked about immunization, we talked about the vaccines that would prevent pneumonia. And pertussis vaccine, of course, is one that would prevent pneumonia. The other complications include pneumothorax or the air leak syndromes, hemorrhages, subconjunctival hemorrhages, very common in young children, nasal bleed, and sometimes, rarely, they may have cerebral hemorrhage secondary to these attacks of cough. The other complication includes otitis media, sinusitis, They may have convulsions even without encephalitis, and sometimes they may actually have inflammation of the brain parenchyma itself, the encephalitis. We have talked about the ear leak syndromes, a rare complication, or even rupture of diaphragm in young infants, ruptures of frenulum of the tongue. Sometimes they go on to develop rectal prolapse or umbilical or inguinal hernia. Pertussis actually causes some degree of immune suppression, and there might be reactivation of silent tuberculosis in these patients. And as a result of this, many of the children, they suffer from malnutrition. In young infants, sudden apnea and sudden death can occur. Another very important complication, a metabolic complication that occurs in young infants less than 6 months, is metabolic alkalosis because of the vomiting and the loss of potassium and chloride with the vomiting. A long-term complication that might be seen in older children and even in sometimes in adults is the development of bronchiectasis later in the life. The diagnosis is mainly clinical. Of course, the investigation would be supportive and helpful. One might see absolute lymphocytosis on a CBC. The total count might be increased, especially if there is secondary bacterial infection. Nasopharyngeal swabs in the guttural stage may help with the growth of the organism, but this is something very tedious and very difficult to do. Hence, the diagnosis mainly remains clinical. It's a highly contagious, so isolation is very, very important. We need to admit these infants, especially in the initial 2 phases of the illness. We need to make sure about their hydration, if the need of oxygen is there, by looking at the oxygen saturation levels. Nebulization just with saline to soothe their cough and to ease up their secretions, and gentle suction of the upper airways. Some of them may go on to develop convulsions, and you treat the convulsions with short-acting benzodiazepines, or sometimes you may end up giving them long-acting phenobarbital. Macrolides are the specific treatment antimicrobial agents. Erythromycin for 14 days and other antimicrobials may also be given. As with almost all infections, prevention is better than cure. The vaccine against pertussis is highly efficacious, efficacy rate of up to 90%. So what is the close contact? Less than 7 years of age, fully vaccinated, you need to give them a booster dose of DPT if 3 years have passed from the last immunization. And they also need to be on chemoprophylaxis as erythromycin for 10 to 14 days. If they are above 7 years of age and they have received all their boosters, including the booster at the age of 5 to 7 years, no booster is required. However, they would need chemoprophylaxis as erythromycin. A very important thing that has happened over the last few years, and that might not be in your traditional textbook, is the pertussis vaccination to the pregnant ladies. Now, the earliest you can give pertussis vaccine to infants is 6 weeks. But what about the first 6 weeks when the infants are not given the vaccine? They are prone to develop pertussis infection, especially the pertussis pneumonia during this period. And during this period, pertussis pneumonia carries very high fatality. So how to counteract that? The key is to vaccinate the pregnant ladies. So if a pregnant lady is immunized with the primary doses and the booster doses of DPT, the immunity would have waned off by the time she becomes pregnant. But a booster dose in pregnancy would be helpful in passive passage of antibodies against pertussis to the infant, hence protection of the infants from pertussis for the first 6 to 8 weeks. With that, we stop the discussion about the pertussis. Thank you very much.